Hello, my name is Mark Block and I'm Chief of the Division of Thoracic Surgery at the Memorial Cancer Institute in Hollywood, Florida. We see a lot of patients with lung cancer, and I thought it would be helpful to make videos that cover some of the basic things we talk about. In other videos I've talked about lung cancer staging and surgery and how to understand imaging. In this video I'd like to talk about mediastinal staging. Mediastinal staging is really important in order to define how we want to best care for somebody with lung cancer. In an earlier video, I covered the concept of lung cancer staging on a scale from 1 through 4. And I discussed that with stage 2, lymph nodes in the lung are involved, and with stage 3, lymph nodes in the middle part of the chest, or mediastinum, are involved. And the treatment is very different. If we find cancer in the lymph nodes in the mediastinum, then we recommend chemotherapy and radiation therapy. We do not recommend surgery right away. So it's important to know if there's cancer in those lymph nodes. Now, a CAT scan will tell us if the lymph nodes are enlarged, which is a sign of cancer, but that's unfortunately not very accurate. It's only about a 50-50 chance that that CAT scan will tell us the accurate result. In other words, that an enlarged lymph node will have cancer and that a normal-looking lymph node will not. We also talked about the PET scan. A PET scan shows us the metabolic activity. And so we would expect that if there's a cancer that has high metabolism, and now the cancer involves the lymph nodes, that also would have high metabolism. So we'll often see lymph nodes that light up on the PET scan, and there's a pretty good marker there is cancer there. But usually we don't rely on just the PET scan, because the PET scan can be wrong. And so we often need to sample the lymph node. That's called mediastinal sampling, or invasive mediastinal staging. We need to get a piece of the lymph node to look at under a microscope to make sure that we know whether it's cancer or not. It's so important to deciding the best treatment that we often recommend a separate procedure just to do that. Now, there are several ways to do invasive mediastinal staging. The gold standard, or the traditional approach, has been an operation called a mediastinoscopy. That's a fairly safe procedure. It's done under a general anesthetic. We make a small incision right above the breastbone and put a special instrument down alongside the windpipe. We can use that to take little pieces of the lymph nodes along the way. That's a very accurate and, in most cases, very safe procedure. In recent years, there have been some new technologies that we've taken full advantage of that seem to be replacing mediastinoscopy, and that's called endoscopic ultrasound. There are two forms. One is called EUS, or esophageal endoscopic ultrasound, and the other is EBUS, EBUS, or endobronchial ultrasound. We use an endoscope, a bronchoscope, or an esophagoscope that normally goes down into the windpipe or down into the esophagus. Those scopes have a little camera on the end so we can see what those structures look like. The newer scopes have a small ultrasound transducer on the very tip. You may be familiar with ultrasound by looking at images of fetuses in the womb. The ultrasound image helps us look through structures to see what's on the other side. So when we use one of these scopes that has an ultrasound image on the end, we touch it up against the wall of the esophagus or the wall of the trachea, the ultrasound image will show us the lymph nodes. There's a special channel. We can advance a small needle through that channel directly into the target lymph node under ultrasound guidance, use that needle to suck out a little bit of the material, and look at it under the microscope. It's a very safe procedure. It takes about 20 to 30 minutes. It's an outpatient procedure, and usually we can do it with just general light sedation. It does not require a general anesthetic. And we've had very good success with this test. It's very accurate at telling us if there's cancer in the lymph nodes or not. So I have a picture here of a PET scan to help illustrate what I'm talking about. So this is a PET scan of a patient who has activity in one of these lymph nodes. The patient has a cancer we know about, and now we're trying to decide whether or not there really is cancer in that lymph node. So as you may recall, if you're looking at a scan, you have to imagine you're standing at the foot of the bed, looking up at a cross-section through the patient. Here's the right lung, and here's the left lung. Now, this is an image that fuses the PET scan image with the CAT scan image. So these muscles and bone and everything is coming from the CAT scan, and this yellow spot here is from the PET scan. And what it does is it focuses us on that lymph node there. There's a lot of activity in that lymph node. So that activity tells us that there's a lot of metabolism in that lymph node. Now, that could be from cancer cells that have gotten into the lymph node, or it could be from an infection that's gotten into that lymph node. How do we take a piece of it? Well, if you look carefully, you'll see this black circle here is part of the windpipe. That's the main branch into the right lung. So you can imagine that we've put our camera in here with our ultrasound. The ultrasound image will show us that lymph node, and we can use a needle to puncture through the wall of the windpipe and take a small piece of the lymph node to look at under the microscope. That's very accurate, doesn't take very much time, and is very safe. The risk of complication is very, very small. This particular lymph node can also be sampled by going through the esophagus. That's called esophageal ultrasound. You might be able to see it here, but this is the esophagus. The small little black spot is the central portion of the esophagus. So you can see that if we put an ultrasound transducer in the esophagus, we can see the lymph node from the other side and get a sample with a needle that way. So that's called endoscopic ultrasound. And in general, we use endoscopic ultrasound for our invasive mediastinal staging. If we're concerned about a lymph node, we get a negative test with one, then we may recommend doing another test to be sure. We want to make sure that the lymph nodes are clear of cancer before we recommend surgery. Similarly, we don't want to just assume there is cancer there and that this patient is not a candidate for surgery. We want to be sure that what the pictures are telling us are correct so we can make sure our patients get the best treatment. Thank you.